just wondering if you'd walk us through the logic that Canada has not taken the step of restricting international travels. Is that we don't agree with perhaps the science in those countries or the experts in those countries that advocate for such a move?
Different countries will have experts that give them advice that is suitable for their own situation. We have followed the instructions and the advice and the recommendations of our top public health officials. We will recall that in the a number of weeks ago, in the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
Hi, I'm just wondering if you can explain why it wasn't until today that you told Canadians not to travel outside of Canada. It was a recommendation made by other provinces earlier this week. It's been a concern that's been raised constantly that this disease is coming into this country from outside. Why did we not tell Canadians until today, don't travel?
Secondly, the long-term implications of shutting down borders is one, they're not very effective in controlling disease, as in fact, they're not effective at all. And secondly, they actually long-term can create a greater risk to global public health.
The Americans said that they were closing their doors to European flights. Well, here in Canada, we make decisions based on evidence and science, and based on what is the best for the safety of Canadians.
But why not close the border? I mean, knowing everything we know, why not say tourists can no longer come here and just shut it down? What's the science telling you about that?
So the science at the moment, if you look at the global epidemiology to date, and there's actually some studies to this effect, that countries that have enacted travel bans, for example, have not been able to keep out this particular virus. And you can probably see some of these countries as you look at what's happening in different places in the world. And so I think that we are driven by the scientific knowledge as of this point. The front end border is but one layer of protection, and it's never perfect. You can get people coming in different ways as well. And I think what the science is telling us and the publications on which countries have been impacted the most, some of them have actually been the ones with the most stringent travel and border measures
than your government has had in the past. You insisted, when questioned, that the science did not support closing the borders. Does the science now support closing the border?
According to the Public Health Agency officials that you would have heard perhaps today, Dr. Tan and all of her great experts and the wonderful team that also find elsewhere across provinces and territories, that's what they now say.
We will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens. Second, air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveler based on guidance from the Public Health Agency of Canada.